it's very expensive to get insurance, but nevertheless, I lived with no insurance for a number of years, and I'm not afraid to do that because that's what it was like when now I'm older than some of you, but years ago, let me explain what it was like. When I had my first child, there was no such thing as medical insurance covering office visits or prescriptions. That's kind of a new thing. And I remember taking my baby, your baby's age, to the doctor, and he gave us a bill for $62. And I was shocked. Yeah. I'm like, gee whiz, these kids are expensive.
Like the only place where there hasn't been inflation, I guess, because it's about the same.
But the point is, I figured, that's my baby. It's my job to do what I got to do to take care of him. Another interesting story that happened, fast forward, I've got a 3-year-old. I was walking through the room, and she was coming after me and grabbed my skirt, but she grabbed the part of the skirt that didn't have any legs in it, and so she fell down. I picked the child up, and I looked at her, and I'm like, oh my goodness, she needs stitches in her forehead. It just popped the skin open. It's amazing how that happened. So I went I went to my telephone, and I called the urgent care center, and I said, can you give me an estimate on about 5 stitches in the forehead in a 3-year-old? Well, the nice urgent care lady said it'd be about $250, and it would be, but I don't think you should bring her in. The guy working tonight is not good with children. So that's what I needed. Then I called the emergency room at the hospital, and I said, I asked the same question, and you're right, they're clueless, whatever. Oh, I don't know. It depends on if we have to do an MRI or a skull x-ray. So this is sad for me because they're taking away my choice. I should retain the right, and I don't deserve to be vilified if I don't want insurance. And people without insurance sometimes frequently pay their bills. Missouri has a high Amish and Mennonite population, and they do not believe in insurance. But when they go to the hospital, they pay their bills, and they're good people, and they deserve some respect. So I'm a little bit offended at the presumption that the goal is everybody to get insurance. Can you comment on that? Well, one more two-part. This is a two-part. Missouri, some of the states are so highly offended at this cram down your throat legislation. We're thinking of doing a carve-out where we say, look, we'll keep our money and we'll do our own insurance our own way and just go away and we won't participate. What do you hear about that?